All right. So this episode isn't about psychedelics. It's about war and the one inside your nervous system. Because for a lot of guys, especially like us, whether it's veterans, operators, entrepreneurs, or just people who carry responsibility like it's oxygen, therapy doesn't always work. SSRIs, numb us out. Talk therapy circled our trauma, but never really decoded it. Um, and nobody ever taught us how to process the battlefield that we walk back into called life. And that's part of why I built SPG, and that's why I coach. Uh, because, as a former Marine who's buried friends, lost my own structure, and come back swinging, and now I'm working on a degree in trauma psychology and working on a company that rebuilds men at a cellular level. Uh, Today we're cutting past some of that noise, and you're going to hear from someone who's not only theorizing this, but he's living it. He's watched trauma walk into the room and leave completely changed. Brent here is a nurse who I am lucky enough to call a friend, I would say. And you have made the transition from more of the traditional nursing career into ketamine therapy. So let's hear a little bit about the background on that. Let's start from ground zero.
All right, yeah. So my name is Brent. I've been an ER nurse for just over 5 years. I did 2 years in Texas, specifically like learning the groundwork basics of nursing, like in the ER trauma setting. And then I did travel nursing for 3 years and just traveled throughout like the northeast area. That's actually I met Steven on one of the travel assignments. Um, but yeah, definitely put through the ringer of high nurse to patient ratios and just seeing the worst of the worst that you can see, as a non-military person in the setting of emergencies and trauma. Um, I There's definitely kind of like an area where. I don't want to say you're told like be a man, but like in a setting where there probably should be more debriefings of on situations that might have been like especially traumatizing, whether it's like resuscitating a child or dealing with parents who just lost a loved one in any setting like that. These high pressure, high volume situations kind of hospitals maybe don't make time for their healthcare workers who are also grieving along with these people who have lost their loved ones. And it weighs on you after repeated exposure over and over, and you really have to compartmentalize to prevent it like affecting you at home.
Well, and not to mention they have you guys on these such long shifts. Like most of you work 12-hour shifts, right? Like for the
Yeah,
most part. So not
minimum. Yeah.
only not only do you have that like severe mental stress from, especially tough days where, you deal with some things most people will never have to see in person, right? Um, then you go home and your body is also completely beat up on top of it. And then I know uh like you were getting into your own kind of health, fitness, and wellness journey. When we met and I saw you start transforming in a couple different avenues there, you were doing a real good job. Um, but yeah, I don't think people really grasp the full weight that especially like trauma center nurses and EMTs and things like that. I work with a lot of first responders. Um, just the overall weight that they carry from their day-to-day lives is so much more than most people.
Absolutely. Um, Recently I went to my girlfriend lives in New York City, and so we moved here, and so took a travel assignment at one of the hospitals in New York, and the culture, like the nursing culture, is so much different from the rest of the country. That like a normal nurse to patient ratio in most of the country is like 1 to 4, 1 to 5, sometimes 1 to 6 if it's like, fast track type patients, low acuity. But in New York, they don't really go by nurse to patient ratios. They just go by staffing of the whole emergency department. So frequently, I mean, frequently meaning like daily, I would have one to be responsible for 10 patients at a time. And there were a few times where it got to like 1 to 16, and just it's literally impossible to provide quality nursing care to that many people at a time when they're actually having real emergencies. Um, and yeah, I just kind of after it broke me down to a sense that like if I continue down this path, I'm going to end up quitting nursing because I'm so stressed and I know what quality nursing care looks like. And because I know how good it can be, um, and I know these patients are not getting that, it was really tough. And like I was like kind of having an identity crisis a bit because I was like, I wanted to be a provider. I wanted to go nurse practitioner route in emergency medicine. But I'm like, if I'm going to live in New York City, I'm not going to be able to do that because it's so high stress.
So that's I was gonna say because I know uh the ketamine therapy was not your initial route. That wasn't your plan when you moved to, the
Yeah.
New York City area. Um, so what put that on your radar? Was it just kind of like a happenstance, like it just so happened to kind of go that way? What brought you to it? What attracted you to it so much?
Yeah, so I when I was like looking, I was like, okay, I gotta find something else that's not emergency, something, even though I love it so much. And so I looked at like different infusion centers and like as I was searching through different, mostly like looking at like vitamin infusion centers, and I came across ketamine therapy, and I had like heard of it. I'd never had any friends or coworkers that had ever been introduced to it. I had used it in the ER setting a bunch. We use it for uh, like pediatric conscious sedation. Like if a child like dislocates their shoulder or something, ketamine's really good for dissociating the mind from the body, and it has a very short half-life. So like once you give it, you can do a procedure and then it wears off very quickly. So it's used in children a whole lot. And so I
Now
had used,
is that what they refer to as like a quote unquote K-hole for like
yeah. Hmm.
recreational purposes? Because that's a lot of people, I think, and this is, we'll talk about the stigmas and everything with it as well, but I still have trouble with it because when I hear ketamine, I think of some dude in a like spaced out on the couch while there's someone else ripping a line of cocaine in the kitchen. You know what I mean? Like
Yeah.
that's the setting I get from it. So I'm like, I don't see where that works, but um,
A
because I've
shirtless at
also
a
I've
Grateful
never
Dead concert or
yeah
something.
I've never done ketamine myself or anything like that, but other psychedelics and things like that are have always been interesting to me.
Hmm.
Uh,
Yes.
so
So the setting like of the clinical what I had used it for, like I said, the procedural sedation, sometimes they do it for intubation. So I had been experienced with it, but in the hospital setting, it's like you're giving an IV push. Like it's very high concentration all at once. In the setting that I work in now, it's not like that. It's given on like we check your weight and we do milligrams per kilogram over the course of a whole hour, which would not be given in the hospital in that setting unless they're on like a drip, which is I'd never done that as a nurse before. But and ketamine therapy for like mental health, we do it for PTSD, depression, anxiety, OCD, alcoholism. The vast majority it's for depression, anxiety, and it's given in the sense that, like I said, it is a dissociative anesthetic, so it separates the mind from the body. And analogy I like to use is the difference between just like doing it recreationally as compared to like in this controlled setting is how like when someone wants to go to the gym and you say, okay, I'm gonna go, you're not gonna get super jacked after one day at the gym, right? It's going to take repeat
right.
events to build muscle. So similar to with neuroplasticity and neural pathways, you're not going to go through this experience once and build these new neural pathways. It's going to take a repeat exposure. We usually do like 2 times a week for 6 weeks, to like while you have this separation of mind and body where it builds these new neural pathways during that time.
That
Um,
allows you to kind of break out of the trauma loop, right? Especially for people who are experiencing like PTSD or CPTSD, things like that. Um, that so if I'm correct, correct me if I'm wrong, but that is what allows you to break free from that cycle essentially, right? Is it's that
mhm.
separation from like mind and body kind of, and then because I've seen some videos, so I'm trying not to say things I don't quite understand, you know what I mean? But I've seen videos where people are talking about it, and it is because they get that mind and body separation. It almost like allows you to kind of step back and really evaluate everything from a different perspective.
Right. Yeah. Different
Um,
perspective. That's what I was gonna say. That's like the biggest thing is like you don't really you're gonna look at your trauma in a certain way for like a long, long time. And this kind of there's two methods to this ketamine therapy. There's ketamine assisted psychotherapy and just ketamine assisted therapy. I'm experienced with ketamine assisted therapy where we put a blindfold on with music and you're by yourself. You know, there's you're going through this experience on your own. And then ketamine assisted psychotherapy is usually like when they take a lozenge or you get a small dose of ketamine and then talk to a therapist. So two different ways, definitely both work. I'm just more experienced with the ketamine assisted therapy, where you're going through this, you're working through this issue on your own, with the addition of you talk to a therapist before and after your experience,
but not during.
not during. Yeah.
Okay.
Yeah.
So,
So
in a sense, I mean, it's not about bypassing the pain, right? Because with most drugs and things like that, because when people hear ketamine, they think like horse tranquilizers, basically, right? Um, but it's not about bypassing the pain. It's about rebuilding, like literally changing your biology so that you can literally catch up to like the experiences you've had,
yeah,
if that makes sense.
you're actually kind of forced not to look over your pain. Anything like there's no hiding any of your emotion when you're under like when you're going through your journey. Anything that you're maybe trying to like not think about is going to come to the forefront. So it's
Oh,
like
man, that's
there's
scary. That's
it is it can be, and people who I talk to them after, I'm like, how was your journey? They can be like, it was very intense or it was very rough because you can have joyous experiences but also you can have like experiences where you're putting in the work, you know what I mean, you're actually thinking and analyzing your trauma or the things that maybe you would try to normally not think about in your day to day, that when you think about them and process them you come out of people some people are sobbing saying it's the most significant experience that they've ever had. And like there's every day I hear people say that this is like monumental, like completely changed their perspective and like they wish they had done it years ago.
that's very interesting. I'm very interested in it for myself, to try, just because I know the person that I've become just over the last year, like being sober. Um,
Congratulations, by the
I
way.
Yeah, thank you. Uh, well, sober from alcohol, we'll be clear about that.
Yeah,
But
yeah, yeah. That's what I was
um,
referring to anyway.
yeah. Uh, but it was a very emotional shift, and from talking to my therapist and everything, it's apparently very common, um, especially in like rehabs, is that like the first like up to 90 days, for people who are really kicking something, that like they experience such powerful emotions because they're used to numbing their emotions. So instead of addressing them like we're talking about with the ketamine therapy, they've been suppressing all of these issues, uh, with whether it's alcohol, pills, what. whatever your vice is, um, even if it's just holding in your emotions, right? Um, I think most of us would rather grind ourselves into the ground uh, than think about actually healing. Um, so obviously, you said that you see all of these beautiful experiences that people have, right? What kind of resistance do you hear? So obviously, this isn't a, I don't want to say it's not well established because obviously you work in a clinic right there. It's an established practice, but it's not, it's new. It's new
Mhm.
to people as far as the therapy aspect goes. Um,
So I actually had
so I mean,
someone, yes, sorry. I
no, go
actually had
ahead.
someone yesterday. It's funny that you say resistance, who they struggle with OCD, and they want to control like every single aspect of their life. And one thing that I met is met when speaking to this individual is that they're not able to let go. And so we have this booklet, and like there's a whole bunch of lists of describing words about how they feel about their journey. And I'll be like, can you please tell me? And every single time he's like resistant, resistant, resistant. Because there is a sense of like you'll get more out of it if you let go. Because like there are
Let
certain
it go
things.
is scary.
Yeah, it is. And like I said, how it separates mind from the body, anything that pulls you back down to earth is not going to help you with that separation. Like if, for example, if you're not wearing the eye mask or you're not wearing the music and you're focusing on the things around you, you're still going to be grounded. You're not going to be separated and being able
Yeah,
to
you're not
process
allowing
your.
yourself to enter that like meditative state. Like you
Mhm.
need to be able to, and because we talk about that now, especially in like the bodybuilding world. I think bodybuilding has always been first on scene when it comes to basically trying anything that can, benefit you in one way or another. So we actually lean pretty heavy into, at least my circle, leans pretty heavy into more of the woo-woo stuff. So when it does come to like grounding, meditation, like just practicing thoughtfulness, positivity, like that kind of stuff, like really does make such a difference in your day-to-day life. So obviously, I mean, to me, it's obvious anyway that like if you're going through something like this, but the whole time you're going through the process, you're kind of, like you said, resisting it, it's not going to work. So, and it's, I run into that with clients is like people who think that they can't get in shape, right? Or that they can't get healthier. If you keep that mindset, like you're right. You know what I
Mhm.
mean? Because you're always going to feel stuck. So like that letting go, I can imagine being very intense, especially if it's all culminated into like an hour instead
Mhm.
of, over the course of like with talk therapy alone, that could be months. You know what I mean? So
Yeah,
do you
it's
see this as like a not not a shortcut necessarily, but like a faster step?
absolutely, yeah, it helps maybe bring out. I'm trying to think of an example. I've had someone who is like resistant, very close, like apprehensive to expressing emotion in any way,
Mhm.
and almost has like a flat affect to him. And before his first treatment, like he would barely speak to me. Whenever I had asked him these questions, he'd just be yes, no answers. Didn't really express any emotion in any way. And then after his first journey, he instantly opened up more and was like, an open book talking about like not only his journey, but like all the things that led up to it, the intention that he set, the things he experienced. And then we talked about like the symbolism to the things that he maybe saw. He would just talk about it, like I think that if he hadn't had that experience and he just went to regular therapy on his own, he probably wouldn't be able to analyze his emotions as easily as he would if he wasn't like his consciousness being cracked open the way it was, essentially.
Right. And do you see for the type of clientele that come in, is it pretty widespread as far as let's say like working class? Do you see white collar and blue collar? You see CEOs and, soccer moms. Is it all over the place or is it kind of more
Um,
centralized?
Unfortunately, with the setting I'm in, like being in Midtown Manhattan, it's mostly like higher end, like 'cause
I mean, you're not going to go into
it's very
Manhattan if you're
it's very expensive. Like, unfortunately,
okay.
for an IB therapy, and it's not covered by insurance. So, if it was covered by insurance and if it was more cost effective, then I'd probably see a wider range of patients. But as of right now, in the early stages of what it is, the only therapy that's like covered by insurance is Spravato, which is like the nasal spray. But that's usually essentially for people who are actively suicidal. There is a wider breadth, but as far I don't deal with this Spravato myself. We have medical assistants that do. I just do with the IV therapy. But yeah, it mostly I would say it's like white collar. There is executives as well. But there is some patients where like they saved for months and months to try this, and like some people are like this, hopefully this is my last thing. I've tried six different um, antidepressants that has not worked. I've had really bad side effects. And usually those are the people who really blossom from it, the people who have tried all these different therapies.
Well, and I can imagine because working with any sort of high performer, whether it is like executives, in Midtown Manhattan or veterans, first responders, stuff like that, they do present themselves exactly in the way you were talking about, like very dialed externally, like very flat, very much like ready for your response so they can give theirs kind of thing. You know what I
Hmm.
mean? If they have one. But internally, they're fried usually. So I mean, that's why you see a bunch of them, right? That's why your business works.
Hmm.
Um, so have you heard or like is it reported that there's significant physical health benefits as well, just associated because I know how much damage stress and elevated levels of cortisol and things like that can do on the body. And I've seen people who completely change their lives just from going for walks outside and being a little happier, you know what I mean? So I can only imagine like this seems like it would be a pretty drastic shift in somebody's life.
Yeah, so it definitely changes like your mindset in a lot of things. And so I wouldn't say the ketamine on its own is changing physically, but it changes your mindset. So
Right,
if there's
indirectly.
somebody who is coming there for anorexia or bulimia, and they're having ketamine therapy to help them get through the issue that they're going through, it helps them with that mindset to help them work with a nutritionist to increase their caloric intake, as well as the opposite spectrum with patients who are we also deal with patients who are having like severe alcoholism, and it helps curb cravings as well. And that's obviously if this is helping them with that, their health can improve with no longer drinking alcohol. So
Absolutely. I
it's
mean,
an adjunct therapy to help them improve their lives in other aspects.
which is incredible if you ask me. I mean, I think they need to change the word ketamine. They need to make it something else so that I don't associate it so much with the, like the rave drug.
Hmm.
Um, but let's go back to that story for a second about the resistant client. Um, just because I think we skipped over the end of that one.
Yeah.
Um, so
Yeah. So
he started opening up. He finally cracked, it sounds like.
he did,
So
I wouldn't say finally cracked. As of right now, he's on the fifth. We do it in six sets of six, right?
okay.
And going from the fourth to the fifth infusion was still having this resistance, and we did a 20 milligram bump to help. It's a pretty good jump in the dosage. We usually do like 10 milligram bumps. We doubled that. Um, and still having some resistance as far as during the journey, like not feeling like he's not fully letting go, fully not like actually letting his mind not be in control.
Yeah, letting
Um,
his mind wander essentially, because like if anyone who's ever tried to actually meditate knows how fucking hard it is. Like if you
mhm.
at first anyway, if you've never tried to like sit and actually let your mind like just let go, it's almost impossible. Like and then the second like you almost realize you're doing it and then it like brings you back. Like so it's I can see where someone and you said he was OCD as well?
Yeah,
Or was that
OCD is the
yeah.
main reason. Yeah.
Yeah,
Yeah.
so I could see where that would be hard for him.
So in a sense, he's more verbal in integration after, to speak to the talk therapist after, but still expressing resistance during the journey. But we'll see how he does on the sixth, the graduation dose, as they say, which is the heroic dose because it goes up and up and up every time.
Okay. And
Yeah.
so this is like, and you said you do it in 6 batches, but I mean, it sounds like he's experiencing some change. Is he noticing the change as well? Or is this just
Yeah,
like, is he
definitely no.
coming in saying like his day to day is different?
Going in the right direction for sure. The work is yet to be finished, though, for sure. I think that usually after the six, we do boosters. If the person feels like they need it, I think this person will probably need maintenance doses, maybe once a month.
Right. Well, and that's, and you said,
Yeah.
it's what, 2 a week, 2 rounds a week you
Yeah,
do?
2 a week.
So
Yeah.
if you're only doing
Some
six, I
people
mean,
do
think
it
about
weekly, but
if you're thinking about like the years of stress and trauma and just the time that you've spent wiring your brain to work in a certain way, like the fact that
Mhm.
you can see that drastic of a change, especially in someone with OCD, because especially some cases of OCD are like debilitating. Um,
Absolutely.
so to see that level of progress in such a short amount of time, because even if that's over the course of a couple months, right? Nuts to
Mhm.
see that kind of change, let
Absolutely.
alone let alone in a couple weeks. Like
Hmm.
I don't know, that's mind blowing to me that that's even an option, and the fact that we can do that for people and it's not being covered by insurance and like all these other things, like it's mind blowing that the system really does do everything it can to not help people.
I know.
Like
I
that's
feel like
really
it's
what it feels like.
hopefully along the way, it just has to do with regulation. In the future, hopefully, it'll be covered by insurance. The Spravato, the nasal spray is,
Mm.
and there's very set rules on how it's
Right.
administered, when vital signs are taken, and it's heavily regulated by the DEA as well as the IV. We've had the DEA come and monitor and check our systems, make sure everything's very legit. It's just for the safety of the patients as well. And I think in the future, people will see, hopefully, legislation will be made to where it can be covered by insurance because it is helping people every day. I see it, like I see the results. It's definitely not like, is it helping? Like, there's no question in
Yeah,
my mind. I was actually apprehensive whenever I first started. They encourage all of their employees to try a journey once IV. And so I
understandably.
was initially kind of apprehensive because I hadn't done it. And but then, I mean, after like 3 weeks of working there and seeing how positive a difference it's making in people's lives, I remember I had one patient who he like lost his mom, and so he had pictures of her around him and like had like a letter that she had written him. And I went in there when his journey was finished and talked to him, and he was just crying, so happy, like because he had had this amazing experience where he like visualized seeing his mom with like angels all around her and got to speak to her like this crazy cathartic experience. And he was so happy about it and told me I signed up that day for mine. And I was like it made me so happy. And my experience was quite amazing as well. Like I can tell you a little about my experience was that so you know put the eye mask on, put the music on, and we have this room. It's like a projector on the ceiling, and it's like a galaxy. And so I initially felt like I've been skydiving before, right? A few times. And whenever it first started, I felt like the feeling of the air that you feel when you're falling, but like I was facing up. I wasn't facing down. So I felt like I was falling and I felt like a leaf in the wind, and then I turned into like a liquid. And then had an experience to where I was like flying through space because, you know, I had saw the projector, so I think my mind was there. And then I just had like different changes in scenery to where like I felt like I was in the ocean, and then I felt like I was in the desert, and then a moment where I was like looking up over the planet of Jupiter, and I was like, you know, the big red spot on Jupiter. Well, I was looking at that storm, watching the storms, and my body became the storm, and then my body was like being pulled in different directions. Very psychedelic, crazy experience.
Sounds
Yeah, it
crazy.
was very, very positive for sure. I was going at it with a pure curiosity. I felt like it was very important for me to have that experience because now whenever I speak to patients, it's a lot easier for me to relate and ask
Yeah.
the right questions because I found before I did before I had the experience, I was asking the wrong questions. For example, I asked to somebody before my journey, I said, what did you see? Like thinking that they were gonna have some hallucination because I'd never done it, and so I didn't know. And she's like, "That's the wrong question." And then I had the experience myself, and I was like, "Oh, that was like not everybody sees something. I should ask, what was your favorite part, or you know,
Like, what
any
was your
notable
experience or whatever?
memories?
Yeah.
Yeah,
That's
something
that's very
open."
interesting. So I am curious, how has this changed you? I mean, what shifted in how you view your own body, your own mind, your own mission?
Hmm. I think it's helped me like open up and actually think about mental health a lot more. I think in the ER setting, it's kind of like there, you know, if somebody's having a mental health crisis, of course, we're going to check them out medically, make sure they're not having like a chemical imbalance, make sure there's nothing medically happening like physically that's causing them to have a mental breakdown. But then once they're cleared of life-threatening illness or injury, we send them on. So this is my first time actually being in this setting to where we're facing mental health head on, and uh, you know, we're not just covering life-threatening injury. We're covering, you know, preventing the life-threatening things from happening
I was
before
just
they
gonna
do.
say, do you see this? Do you see this as becoming more of a preventative medicine as opposed to a therapy in response to? Because
Mm,
I could see where this could potentially. I mean, because like you said, maybe like microdosing once a month or something like that, like down the line, especially if it is mainly used at the moment for anxiety and depression. Like I could see where preventative aspects could come into play, especially since like I'm a firm believer that like everybody should go to therapy at some point, at least, you know what I mean? Um, Now this isn't to say that everyone should try ketamine, but
I
like
think
I
the
could see
guidelines are
the
too strict. I think since it's a controlled substance, it would be there would be too many people taking advantage of it for it to, unfortunately, the world we live in, if it was preventative, like let's say preventative in the state that somebody doesn't have any mental health issues on their record at all, and they go and do ketamine to prevent it, it would kind of leach into people doing it recreationally more often than being it preventative, unfortunately.
right. I guess it is
Um,
kind of hard to use preventative medicine on, I don't know, like
it's,
it's an interesting topic. I would like to
it's
dive
possible,
into
but
that
I think
more.
people would take advantage of it.
Yeah,
My
I think
personal
maybe
opinion.
ketamine specific, maybe not the best, but
Yeah, I think the recreational scene is big enough that people would take advantage of it if it was preventative.
yeah, I can see that. But brother, I appreciate you kind of pulling back the curtain a little bit because I had no idea what like ketamine therapy was. You know what I mean? I've seen the videos occasionally I come across where it was like a guy like in his car before and after.
Hmm.
And it was like you were saying, like before he was very like hard and closed off and like I don't know why I'm here kind of thing. And then like it cut to him in his car and he was like crying. And it was like
Yeah,
this like tough guy, you know what I mean? So it was very interesting. I'm curious. I know other people have got to be. Um, but this is how we change lives, right? So,
absolutely.
to everyone listening, if traditional talk therapy isn't working, maybe the system for you is broken. If you've been, stuck in your patterns, your pain, your own mental war zone, there is a way out. It might not be easy, it might not be fast, but it's fucking real. You just have to want it more than you want to stay numb, I think. Because like you said, I think a big portion for a lot of people is that resistance. And, especially if we're seeing it in uh, people who want to change, right? So even whether it's a physical or mental thing, like we have people that come to us saying they want a certain outcome, they want to change, they want this thing to be different, and then they resist it at the same time, right? So change is
Absolutely. I
not something that's easy. But I don't have anything else. Do you have anything else for the people?
think that's all I got.
All right. Well, if anyone wants to reach out to you and maybe ask some questions about ketamine therapy or anything like that, is there a place that they can reach you?
Yeah, Instagram, Brent Junior Bowen. That's my Instagram.
Perfect. And I'll obviously tag you and everything as well. But you can find me at Coach Steven underscore on Instagram or SPG Fitness and Wellness. This was SPG Unfiltered. Reclaim your life, master your mind, and build your body. Let's move.